Hello, it's good to see everyone today. For those of you who don't know me, my name is Chad David Novak, and I'm a UX researcher and designer. Today, my team and I are going to share with you a digital platform that reimagines practice management software for therapists. It improves patient interventions and solves a problem that affects therapists and patients across the country. But first, I'd like to introduce to you my team, Ayantu Gamtessa, Chloe Dalbard, Damian Wojtowicz, and Trevor Charon. Now I'm going to hand things off to Chloe for some background and context.
Thank you, Chad. According to a 2024 article by Mental Health America and the CDC, nearly 60 million Americans face mental health issues annually, with cases continuing to rise each year. When people seek therapy, the focus is often on managing symptoms and overlooking personal history and personality traits. Key details such as a client's upbringing or religious background are frequently omitted. This is cognitive behavioral therapy that is most often used today. Traits like manipulative or irresponsible tendencies are rarely considered during treatment, where the focus is on symptoms, such as recurring alcohol abuse, for instance, without addressing underlying personality traits. This gap often highlights the groundbreaking work of ARCS Institute. Led by Tanya Friedland, ARCS aims to integrate personality traits and client history into diagnosis, supported by a digital tool designed to assist therapists. This is where our collaboration begins. With mental health becoming a central part of public conversations, trends are shifting and treatment plans are becoming increasingly personalized. Now, I'm going to hand things off to Ayantu.
Thank you, Chloe. To better understand these changes, we spoke with the founder, Tanya Friedland, and researcher Robert F. Kruger at the ARCS Institute. We learned that ARCS has an innovative approach to therapy that emphasizes the importance of understanding and working with the client's unique personality by embracing what makes them distinct. Tanya and Robert's vision for the future of therapy includes the Precision Treatment Personality Profile, a scientifically validated tool that identifies detailed personality traits and drives meaningful advancements in the mental health space. Their approach represents a truly novel vision for therapy, but we wanted to learn more, so we spoke with the key stakeholders, therapists and researchers, to understand what would help them improve patient outcomes and the management of their practices. And now I'm going to hand it off to Trevor to say more about that.
Thank you. My friend Ayantu touched on user interviews. We had the opportunity to speak with 5 practitioners, a mix of researchers and therapists, to gain some insights around tools they're currently using and what might benefit them in a potential new platform that integrates the ARCS PTPP tool. These conversations were scripted, but very question-oriented, leaving them a lot of room to speak freely about what they have that works, as well as what's missing. The picture that began to form started with a dashboard, capable of accessing tools and records at varying levels, something with quick access to available tools, as well as the client's records within the practice, both at a glance, as well as expanding the information within a few short clicks. Ryan Thibault, one of the practitioners we spoke with, commented that whatever tools are used within the system need to make our job efficient, fast, and just to the point. It doesn't need to be fancy. We also wanted it to be just as approachable to the practitioner as it might be to a layman who may not be completely familiar with clinical jargon. Robert Kruger, writer of the PID-5 and partner with Tanya at ARCS Institute, said a perfect diagnostic tool would have super accessible language, non-pathologizing, and destigmatizing for the client. Also, with AI making the scene, the team thought it was important to carry that understanding in all iterations that flowered out. Another clinician also said an AI agent could have access to a greater corpus of information, making suggestions more encompassing or divergent from what a clinician might consider. Next up, my colleague Damian is going to walk through our key findings.
Thank you, Trevor. We just heard what each user group needs, as well as the importance of integrating ARCS Precision Treatment Personality Profile into this platform. These challenges inspired us to think about how we could help. With these insights, we designed a digital platform that reimagines practice management software for therapists, improves patient interventions, and solves a problem that affects therapists and clients across the country. And here it is. We are thrilled to share with you Therapy Dashboard. This is entirely new and built from scratch. This is a practice management software solution for therapists that unifies previously siloed tools and information into a single digital solution. Our design elevates practice management software to the next level by borrowing what therapists love about products like Therapy Notes and combining it with research-backed design that provides all the tools a therapist may need to manage client records, schedule appointments, create detailed documentation, and bill insurance, all in one place. But that's not all. Our design integrates diagnostic measures, client context, and artificial intelligence to create personalized therapeutic interventions. These are just a few of the many notable design features. Now, I'm going to hand it off to my colleague, Chad, to give us a full walkthrough.
Thanks, Damian. As you can tell, we're really excited about this design. The feedback we've gotten from therapists convinced us that we're onto something truly innovative and a design that therapists are really going to love. Let me show you why. As we mentioned earlier, all of this is brand new. We sketched, designed, and prototyped what you're about to see from scratch by first understanding our client's business strategy, then conducting research and analyzing the data to inform our design decisions to create something users will find meaningful and valuable. Let's watch as Hannah, a therapist, logs in to begin her day. Hannah lands on the home screen and she sees her dashboard. We've designed a beautiful and simple dashboard that puts everything Hannah needs at her fingertips. Hannah can see her daily agenda, insurance billing codes, client personality traits, and so much more. Everything's been designed to streamline Hannah's workflow and give her more time to focus on what matters, her clients. Let's take a look as Hannah opens one of her profiles. Look at how we've integrated date and time stamping Therapy Notes directly into the summary section. Hannah clicks Details to learn more. The client page allows Hannah to drill down to see every detail about her client, Adam Tate, all in one place. Hannah and Adam are about to start a session, so Hannah clicks Start to begin. Hannah can start a new session with the click of a button. And we've made session logging and recording easier than ever with features like built-in recording, transcription, the ability to export and share, all in one place, helping to streamline Hannah's post-session workflow. Looks like we're all finished here. Hannah's session with Adam is over now, and she's ready to create a therapeutic intervention. Hannah clicks Create. Creating a therapeutic intervention is now easier than ever. With just a few clicks, Hannah can merge outcome measures, diagnostic assessments, treatment plans, and progress notes. And then when she clicks Generate, artificial intelligence takes over and merges all of Adam's data to create a fully customized therapeutic intervention. Hannah can dive into Adam's forms and documents right from the modal and see the therapeutic intervention that was just created. She clicks on Adam's worksheet to see what artificial intelligence has created for her client. It looks like mindfulness practice is on the agenda for her client today. She can close that and also access Adam's treatment plans, as well as Adam's diagnostic forms. As you can see, the dashboard empowers therapists to better manage their client panels, schedules, and profiles. Our design unifies previously siloed tools and information into a single digital solution that improves outcomes. Once again, I'm going to hand it over to Chloe for some final thoughts.
Thank you, Chad. Today, we walked you through our digital platform that integrates ARC Institute's work and reimagines practice management software for therapists. Our design can revolutionize mental health treatment by helping therapists integrate client history and personal traits into their daily workflows. It will allow them to generate customized therapeutic interventions like worksheets and videos using artificial intelligence. We believe the ARC Institute groundbreaking work will transform how physicians approach care, driving meaningful improvements in mental health outcomes. We would like to thank Tanya Friedland and Robert Kruger at ARCS Institute and researchers Colin D. Young, as well as therapist Ryan Thibault, Katie Nulisek, Kelsey Hobbs-Matson, and Hannah Assis for their input and feedback. We would also like to thank Angie Wang and Josh Parrow and the entire Prime Academy staff for their participation and support. And I would like to thank my team, Ayantu Gamtessa, Chad Novak, Damian Wojtowicz, and Trevor Charon. I am Chloe Dalbard, and this was the ARCS Institute Therapist Dashboard. Thank you so much.